We're talking with Dr. Tom. That's Dr. Tom. Dr. Thomas Incledon is the founder and CEO of Causenta Wellness and the Causenta Cancer Treatment Center in Scottsdale, Arizona. And this episode of Ask Dr. Tom is about oral cancer. Before we talk about what it is exactly, is there something that we would, like everybody else, would think of when we think of oral? Like, would we think of it as another name? Like when you say melanoma, I think of skin cancer, and then melanoma. Is there something else that we more popularly know oral cancer by that's a little bit more common?
I've heard people say like tongue cancer, throat cancer, things like that. But I guess, you could, a lot of times cancer is labeled or diagnosed kind of like a geographical way.
Mm-hmm.
All right? So wherever I have that cancer, that's the name I might give it, like socially or in terms of a lay language. But, our understanding of cancer has advanced to the point where what we really know is labeling cancer by geography, that doesn't really help on the treatment side, only because there could be, let's say, for example, I have a cancer in my mouth, and we're calling it oral cancer. That cancer could be a squamous cell type of cancer, or it could be a different type of cancer. And then the type of treatment I need would differ based on, certain genetic aspects of that cancer. So knowing where it is maybe good for talking about it, but in terms of treating it, you need a lot more precise detail. And that's where it could really help, developing an effective plan to fight the cancer.
Okay, so it seems like it may be obvious, but I don't want to assume that it's obvious to anyone. What is oral cancer?
I don't know. No, I'm kidding. Never heard of it. It's basically cancer that's in any part of the mouth.
And you mentioned the throat. So how far away does that extend? Obviously the throat, as you mentioned, but does that include like esophageal cancer or anything in your nose or around it? Is it just the mouth?
Just the mouth. So let me kind of give you, like if we were to break down the anatomy of the mouth, this is the different parts of what we would say of the mouth that you would say here, this could be oral cancer. So you got the tongue, the cheeks, the floor of the mouth, the hard and soft palates, the sinuses, the pharynx, the throat, and so essentially you could say like maybe inside the nose all the way down to the back of the throat, if you're going to give like boundaries, and it's like cheek to cheek, nose to back of throat, you might say, and all that kind of fits under that category.
And so is that also, those areas that you mentioned, is it where oral cancer typically starts? Is there any one that is a little bit more susceptible to the beginnings of oral cancer than any other?
I would say, so it kind of depends on what the trigger was. So you would expect, let's say for men that chew tobacco and drink alcohol, and let's say they keep the tobacco like on the left side of their mouth, you would expect it most likely to start in that left area of their mouth. If it was on the right side, so that would be like one way, you might say, based on the type of risk factor. But if someone has, let's say, HPV type of induced cancer, it may start more towards the back of the throat, may even start more like in the neck region, if you will. So there's a couple of risk factors that may kind of bias it one direction or another.
Are there any other risk factors for oral cancer, maybe besides smoking and chewing tobacco and drinking, that you haven't mentioned?
Those are the big three. And just to kind of just to put some things in perspective, I was looking at a graph of some data one time, and let's ignore HPV, a virus, and let's just look at chewing tobacco and alcohol. And it's kind of like, the incidence of oral cancer is almost non-existent. And then when you add chewing tobacco, it goes up like almost vertical. And then when you add alcohol, it's going up like a straight line. So just from that alone, every athlete that, you see like the stereotype as you see baseball players chewing tobacco, at least years ago. I think now Major League Baseball has, done a better job of trying to educate, like, guys, this is not healthy, because they brought in older baseball players that retired and showed that they had surgery, removed their lips and other parts of their mouth.
Yeah.
And so, I mean, when I think that's a pretty powerful message. When I was in third grade, I think one of my teachers was starting to see lots of kids in third grade smoking. So this is going back 48 years, and he had this idea. He's going to bring in, so he plans a class trip. So he got permission for the principal and all, parents, all that kind of thing, and they plan a trip where they take the class to a hospital where they did lung surgery, so they could see what do people look like that get lung cancer. They had these, and back then, you're talking all these years ago, back then was way more horrible than it is today, because the doctors didn't know as much back then, right? And by the time people were even diagnosed, it was really, really extreme. People coughing up blood and stuff like that. And so here we are, these young kids, and we're seeing like this black junk coming out of people, and you're finding like, here's what healthy lungs look like, and here's what the lungs look like from these guys. And all I could tell you is I've never smoked anything, any type of substance in my life. And whether it was that impression in third grade or other reasons, who knows, but it made a strong impression. So when I saw, the sports groups trying to really, have a better message to their athletes, like, hey, here's what you could expect long term if you go that route, I was kind of happy about that, because I don't want to see anyone do something. When you're younger, you're in your 20s, you feel invincible. You don't think someday I'm going to be accountable for my decisions in my 20s or so. So you got these young athletes that are basically studs, and now they're doing all these high-risk behaviors, but they feel so great, they don't realize the damage that they're setting the stage for long term. And so oral cancer is something that could really be eliminated. So I focused that part on alcohol, or I should say the chewing tobacco and alcohol. Now, as far as HPV goes, a lot of times people just don't know. Like, do I have HPV or not? Is there a better way? You hear all this stuff about, can you get rid of the virus? Can you not get rid of the virus? Can you pass it to your partner or not? There's some really cool tests now. You could do like a mouth rinse, and the mouth rinse will pick up cells in your mouth. You could then send that sample in, and you can test for every form of HPV ever discovered.
Oh, wow.
So I don't know exactly how many there are, because I kind of like some of the different reference sites have different numbers. But let's say anywhere from 18 to maybe 50 forms of HPV have been reported. I realize that's a broad range, but at different reference sites. And so the idea would be this. So let's just say you're wondering if you have HPV and a risk for, let's say, some form of cancer. Well, you could do this test. The test is going to be like maybe $200 or less. And then you just see, what do I have? And then if I don't have HPV, then you know right away. But if you did have HPV, there's some interesting data that things like curcumin and green tea and quercetin, like these combinations, maybe resveratrol, but supplements may be able to help eliminate that virus. Then you could retest yourself and see if it's still positive. And if you're not showing up as positive, then that would be a good sign that, you've at least reduced the threat to your health right now. There's no guarantee it's totally gone in every tissue of your body, but it's at least a step forward in a healthier direction. And we're talking, these are inexpensive ways of helping yourself, and it's like a step in the right direction. Certainly not perfect.
We're talking with Dr. Thomas Incledon, and Dr. Tom is the founder and CEO of Causenta Wellness and the Causenta Cancer Treatment Center in Scottsdale, Arizona. This is the Ask Dr. Tom show, available for subscription on iTunes and on Facebook and YouTube. And I highly recommend watching some of the videos about the patients and their success stories that are available on YouTube and Facebook. All you have to do is type in Causenta and you'll find them. And they're very powerful. Today we're talking about oral cancer. And I think I know the answer to this, but this isn't for me. This is for everybody else. Where does the oral cancer typically grow?
So the notes that we have, the show notes we have, it has a mistake there in the square.
Yeah, I saw
on the table. So the point, though, the answer is that oral cancer can grow in any part of the mouth. So remember earlier we were kind of given like the geographical boundaries, like cheek to cheek, sinus, and the back of the throat. If you want to make it like a square, if you will, you could say anything inside that square or that area.
So maybe you could just recap those, because I think that we're going to cover, we're going to cut out that answer and use it again. So could you just restate even those, the areas where it grows that you have listed maybe above in the oral cancer starting?
Sure.
Yeah.
So you're going to say, where does oral cancer grow? Where can it start? So sort of like the anatomical locations would be like the tongue, the cheeks, the floor of the mouth, the hard or soft palate, sinuses, and the pharynx or the throat. So essentially, any area of the mouth, throat, even up into the back of the nose.
Anybody who's ever eaten cereal or something crunchy or some chips that they don't normally have has experienced you eat something and then you feel like little things going on in your mouth, like, oh, I cut my mouth, or I got a little bump now because I was eating Captain Crunch or whatever it is. How do you then know what the symptoms are to be aware of in those areas, and what might be a sort of a warning sign for oral cancer when your mouth kind of comes into contact with all sorts of stuff?
Yeah, so normally what you would say, like, some of the symptoms of an oral cancer would be like you have a sore in your mouth that doesn't heal, maybe a lump or a white or red patch inside the mouth. So let's say that, to go back to the example you're given, let's just say you're eating something crunchy and you feel a mild burning sensation. That should be gone in like 1 to 3 days. If it's a week later and it's still there, then you got to wonder, okay, why is it still here? Or maybe I should get looked at, type of thing. Usually stuff in the mouth does heal pretty quickly. One of the concerns, though, about there's a lot of interesting information coming out that even something like brushing your teeth too hard and causing an abrasion on your gingiva, like that's like the skin around your teeth. You have these microscopic tears, or let's say damage or abrasions, and that allows organisms in the mouth to now cross the skin barrier and get into your blood. And I think cardiologists became aware in the 1930s that certain organisms in the mouth they find in the plaque in the blood vessels around the heart. So the theory was then formed that, one of the causes of plaque, so like atherosclerosis, if you will, is that there may be a pathogenic element where this bacteria that normally you would think of it is a bacteria can cause gingivitis or some other type of periodontal disease, that it gets into the bloodstream and then sort of takes up residence near, in a major blood vessel to the heart, and starts gradually, things start building up. So you have this plaque that blocks the blood flow and then creates some problems. So with the, so any type of, let's say, breach of the skin barrier sets the stage. Now, bad guys can get inside of our bodies that we don't want, inside of our bodies.
This is the Ask Dr. Tom show. Today's topic is oral cancer, and I'm curious, based on what you've been sharing with us about oral cancer, how would Causenta and how does Causenta present treatment options that may differ for patients that are looking for something that's more customized and personalized to their particular form of oral cancer versus the off-the-shelf sort of standard that other places may be offering?
So once we know the type of cell line that is, let's just say if this person has a squamous cell cancer. Remember we were talking about the different, when we were talking about melanoma in a previous podcast, we had talked about different types of cells in the skin, and now any of those cells can become cancerous over time. And in the oral cancer, keep in mind the lining of, their skin lining the throat, lining the inside of the mouth, etc. So you have some of the same types of cells in this lining all around the mouth. And so you can have like more of a squamous cell type of cancer, or a basal cell type of cancer, as example. That's, like a squamous oral cancer. So we've uncovered how to treat squamous cell cancers, and so far we've been able to treat them without radiation, without chemotherapy, very, very successfully. We've done this now in people even as old as 75 or so. So at an age where you'd say, well, their immune system is weak because they're so much older, we've been able to help patients at a much older age without any chemo or radiation. And so, part of the way we'd approach it is we'd first say, all right, let's look at the whole medical record. Let's get a sense of, was there a good diagnostic workup, so we know what we're fighting against. If there wasn't, we'll recommend some specialized testing. If there was, we would say, okay, we got enough of what we need here. And then we would create a program. And for a squamous cell, it's mostly supplements and exercise. It's very, I would say, very simple and non-threatening. And most people they're amazed at how their body transforms. Now, if it's other types of cancers, like in different cell types, then there may be some other strategies or treatments we have to incorporate in that as well. This is because the different cells, they have different weaknesses, if you will, so it's easier. Like, we figured out a few really well so far, and others we're still collecting data on to figure out the best way to approach it.
And so the best thing that you can do is, if you're experiencing any of these oral cancers or had a diagnosis, you go to Causenta.com, and there's a form where you can set up a free consultation and see what a program would look like for you at Causenta. That's Causenta.com, Causenta.com, or you can call, if you're a phone person, call 480-883-7240. I'm going to give you that number again. It's 480-883-7240. So I know you have looked up a bunch of statistics, Dr. Tom, about the frequency and how serious is oral cancer, and what do the numbers look like?
It's pretty serious. I could tell you personally, I can remember a time when years ago, I would say people would come in, and a diagnosis then they were usually given was like a head and neck cancer. Then over the years, you start seeing things would be kind of teased out, and it might be oropharyngeal. So it's like, think of it as like mouth, throat. Then nasopharyngeal. So think of it like nose, throat, so they had different ways of sort of categorizing where the cancer was, let's say the head and neck area. And what I would typically see is by the time someone would sort of get into a medical system, things were pretty advanced, meaning they had like a really big tumor inside of them or something in the back of the throat. And, they just, you wonder, why did they wait so long, before moving forward? And I would say in every case, I can remember looking at some of these medical charts and stuff like that. I would say almost everyone passed away. So the numbers were not good at all. Even to this day, we know certain HPV-induced cancers, the treatment outcomes are really poor. So that's kind of, it inspired us, because we're looking at all this outcome data at centers all around. It inspired us to really work aggressively to figure out something. So at Causenta, the outcomes we have for, let's say, HPV-induced cancers are really, really impressive. And so if we look at now some of the 2019 data for the American Cancer Society, this is some simple stats, if you will. About 53,000 people will get some type of oral cancer. Of those 53,000, around 11,000 will die from that cancer. So you might say, 20%, let's say. The cancers are more than twice as common in men as women. They're about equally in blacks and whites. And then in recent years, there's been an increase in the number of people that are showing HPV positive cancers. And part of that is because we have better methods now than we did years ago, so it's easier to detect it. But recently we've had interesting case. We had someone with a mouth cancer of the tongue, so on the back of the woman's tongue, she has some cancer. And when they first tested her, they said it was HPV negative. And then we said, well, we think it's going to be positive. So we asked them to retest the biopsy specimen. And when they did, it came back positive. And so, it's possible that maybe the sample of tissue that was tested didn't have the virus in it. So the expectation is that because HPV-related cancers are on the rise, we tend to expect most new cases to have HPV. And if it's a mouth cancer, we expect there to be HPV, just because it seems to happen more so than less so. It says here that the death rate for these cancers has been decreasing over the last 30 years, but I want to just make a point that happens because they're diagnosing the cancer earlier. That is not happening because of better treatment options. When you look at, if you break it down to like staging, and you look at people, let's say at stage 4 versus stage 1, people at stage 1, almost 100% treatment success. People get to stage 4, their outcomes are not good. And a lot of times the data is a little, I would say, manipulated, because let's say you have stage 4 cancer and you've been on this regimen, and now you got an infection and you die from the infection. Your immune system was weak, so you got an infection, but the cause of death is not listed as the cancer, right? So there's some playing around with the numbers there. If the cancer was treated successfully, then your immune system may not have been weak, and then you may never have gotten the infection. So you see there's different ways of looking at it. And then you kind of, we touched upon this a little bit earlier, and I was talking about, depending upon whether someone chews tobacco or someone has HPV, but some of the most recent stats on where does mouth cancer most often occur: the tongue, the tonsils, oropharynx, so the throat, the gums, floor of the mouth, other parts of the mouth, sometimes the lips, sometimes salivary glands, and it could be other sites. And so it ties back into, in the data that the American Cancer Society is sharing, they're just saying, here's where we find it happening the most. The details I was adding in earlier is that the geographical location is dependent upon the threat to that local area. So if I'm doing something bad on this side of my face, that's where I'm more likely to get cancer, is that left side. Then in terms of most people are older, meaning the average age of getting this type of cancer is 62, but they can occur in younger people. But some people, like about 25% of the people, are under 55. So you're still seeing it happen more in older people. And then the rates of the cancer seems to vary in different countries. So right now it seems it's more common in Hungary and France than the United States, and it seems to be less common in Mexico and Japan. So whether it has to do with differences in geography, where they live in the world, or is the food intake, or some other reason, it's not so clear. And then one of the things that sometimes happens is that when someone has one of these cancers, is they get nodules in another part. So let's say there may be cancer in one part of their body, one part of their mouth, I should say, and then there's a little nodule forming somewhere else. And so what I want to kind of like some insight to share is the expectation I would have is that normally people, when they have a mouth cancer, they're worried about killing cancer, and they may talk to an oncologist, but it may be strategic for them to see ENT, like ears, nose, and throat specialists, so that they can look at their anatomy and say, wait a minute, there's something really tiny over here that doesn't belong there. And the strategy is before it becomes a big threat, and it's a tiny little dot, just get it removed, right? So that way it's like an easy fix, you're in and out, in an hour, let's say, from a surgical procedure or less. It's not waiting till it gets so big. And the reason why I say that, a lot of times people come in and they'll say, yeah, I saw my doctor, and I said, oh, what did the doctor say? And they say, he wants to wait and monitor it. And I'm like, it's a bump. It's going to get bigger.
Right.
And if it, why wait? What do you need to find out here, right? And even if it was, let's just say, if it wasn't cancerous, why take the chance it becomes cancerous? Like, it's kind of one of those things like doing that type of surgery that's so tiny, there's no real threat to your health because it's an easy surgery. Any surgeon could do it in their sleep. Like, surgeons are much more skilled than that type of procedure requires. But the consequence of not doing it, and now it becomes worse and messes up, your throat. Well, now you have a voice box and you can't talk and you got to use all these contraptions. Like, you know what I mean? So the way I would look at it is it's better to do something like that maybe you may not need later versus not do it. Something happens and now you have, a hole in your neck or a hole in your throat or something like that.
So I'm asked all the time by patients, what's the difference between personalized medicine and traditional medicine? And in traditional medicine, there's a singular approach. So you have cancer A, and for cancer A, here is the standard of care treatment. And after you go through the standard of care treatment and it doesn't work, typically there's not a plan B. There's not another option. So then patients are told, hey, there's nothing else that can be done. And so then they're convinced that, hey, there's no hope and we can't do anything else. Now, I want to contrast that in a personalized approach that we have at Causenta. We're going to measure all kinds of details within your body. And we're going to find lots of areas that we can actually improve your health. And then indirectly, by improving those areas, we're going to help you do a better job at fighting cancer. So where someone else would say, hey, there's nothing that could be done, we're going to say, hey, there's lots of opportunity here to improve your health and make sure that you have a better quality of life so that you're able to function and live life under your own terms and not just waste away in a bed in hospice somewhere and watch everything go by you as time passes on. So if you or a loved one has been diagnosed with cancer and you're looking to get help, I strongly encourage you to go to causenta.com and fill out the form at the bottom of the page and find out for yourself how we can help you.